Ask the patient what you can do for them. So imagine that conversation, it was about the mountain bike. And at some point, clearly it's going to shift. And Paul or Tim are going to say something like this, Tim, it's so nice to meet you today. I appreciate that you've chosen my office for your dental care. What can I do for you?
All right.
And listen. Because you could get all kinds of responses. Well, doctor, I just moved to town. I met my neighbor next door. We're trying to get settled in, and I wanted to find a dentist. I talked to my neighbor next door, and she said, you guys were awesome, and that's why I'm here. Nothing's going on. I just wanted to get established.
Right. Another question I think you taught me is, if you and I are talking in 3 years, what should happen to your oral health and smile for you to be happy with it?
Now you're getting way ahead. Don't start there.
Right.
Don't start there.
Don't start there. Okay, got it.
Don't start there.
Right.
What brings you in today? What can I do for you?
Right. Just to kind of get acclimated, just get comfortable with the whole thing.
I mean, here's the answer you want every time. Imagine a patient, 62 years old, female patient, 62 years old.
Mm-hmm.
And let's just call her Martha. And imagine Martha, when Dr. Paul says, Martha, it's so nice to meet you. I appreciate that you've chosen my office for your dental care. What brings you in today? And imagine Martha saying, well, Dr. Paul, I have a lady that I play bridge with, and her name's Susan, and she's a patient of yours. And you did this beautiful smile makeover for Susan. And honest to gosh, Susan looks 15 years younger. And of course, now Paul's going to remember her, of course, and Martha says, Susan looks 15 years younger. Now, I want you to do for me what you did for Susan, except I want you to make me look 20 years younger. Now, that's the answer you want every time. And let me tell you that you're not going to get that every time.
Right. It
might be, Doc, this tooth on the upper left has been keeping me awake at night. Now it kind of comes and goes. But sometimes it spikes and it's so much pain. I can't sleep. That's why I'm here. So ask, what brings you in today? What can I do for you? Hey, how come you're not taking my insurance anymore? Now I asked it in a very blunt way, but I want every team member to be able to have some level of conversation with the patient with that question. Now, they don't have to be the expert at it, but I want them to have some level of communication, because patients don't discriminate who they ask the question to. They'll ask that question to whoever happens to be next to them. Now, and I don't want any team member just folding their tent and saying, I don't know, I'm an assistant, I don't know. Because what message does that communicate to the patient? It wasn't a confident message. So I want any team member to be able to say, Naren, I'm so glad you asked that question. Let me share with you. First of all, Naren, every patient in our practice is important to doctor and our team. You are important to us. Now, remember, if you have been working on the relationship side of your practice, that's a true statement. You will feel that. Would you agree, Naren? In other words, if we've done the things that make a relationship practice, when I say you're important to us, in your mind, you're thinking, yeah, I get that. I get it. If you haven't done that, then that's an issue. If you're not recording your calls, doctors, you have no idea what's being said on the phone. You have no, and oh no, I know, Gary, I know. I mean, Susan's been with me for 25 years.
Right.
I know. Many doctors don't have the support that they want their practice to have. The doctor has a growth perspective. I want this practice to grow. I want double-digit growth every year. And that may not be supported by everyone. You might have a team member that says, that just means more work.
Right.
So no, you don't know. And so, yes, you need to record your calls. You can do it legally. It is legal. You have to do it legally. And you need to use those calls in a coaching capacity. We do it at Life Smiles. The way I like to do it is for whatever the period of time is, I like to have 6 calls that I sit down with the team and do some coaching with. And this is just like a football coach watching game film, where we're always going to get better. We want to be better tomorrow. Part of our culture is we want to be better tomorrow than we are today. And I want to emphasize, you do not use these calls as a club. If you're going to use them as a club, don't do this. Mm-hmm. You do not use this as a club. You use it in a positive training approach. You create a safe environment and you use it for positive reinforcement and training.